Who is a good candidate for iStent Inject? When should I consider it as an option? When is it not a good option? Want to know what you need to know about the new iStent Inject, who and when, in the next few minutes? That's what we're about to cover in this fourth iStent Inject video in the MIGS University series. Keep watching to learn more about the latest in glaucoma surgical innovations and how to utilize them in your patients. This video was in part supported by a Glaukos. Hello, and welcome to the iGlaucoma YouTube channel. My name is Dr. Constance Okeke, glaucoma specialist, cataract surgeon, and performer of over 5,000 MIGS surgeries over the last decade. Have you thought about adding iStent Inject to your new surgical armamentarium of MIGS surgeries, but wonder if it's a good option for your patients? Well, personally, I think with a new design, greater efficacy compared with the first generation stent, and excellent safety profile, you will likely be able to find a great number of glaucoma patients that can benefit from iStent Inject in your practice. With that being said, I'm excited to share with you the now fourth video of the iStent Inject glaucoma video series called MIGS University, where we're all about learning innovation step by step. If you missed the first, second, or third video of the iStent Inject series on the what, where, why, and how of iStent Inject, click on the links below or on the card above to check them out. Also, stay tuned to the end for access to a special gift for those of you who have watched the whole video series and, like myself, love access to a review guide. In today's video, we are going to cover the patient selection pearls for iStent Inject. So, let's dive in. First up, who is a good candidate for iStent Inject? Well, this device is FDA approved to be performed in conjunction with cataract surgery. So you're looking for open-angle glaucoma patients that have a visually significant cataract. The indicated stage of glaucoma is early to moderate, and the patient should be either controlled or uncontrolled using 1 to 3 glaucoma medications. When should you consider iStent Inject as a good option? Well, first, look at the angle on gonioscopy. Is it open and is it normal? This is a good start. Confirm the adequate stage of glaucoma based on your exam and diagnostic testing. Will this be covered by the patient's insurance? If yes, great. If not, ask yourself, would the patient be willing to pay out of pocket? These are real-world questions, and you need to have the answers. If a patient is noted to have an issue with non-compliance due to forgetfulness or untoward side effects, this can make a great candidate. If a patient failed to get controlled after laser trabeculoplasty or SLT, or if a patient has significant ocular surface disease or allergies and is intolerant to glaucoma drops, these make great candidates. If a patient complains about having difficulty keeping up with the cost of their medication, all of these are good reasons to consider iStent Inject combined with cataract surgery. When should you not consider iStent Inject? If on your clinical exam you see a 0.95 cup and the eye pressure is, say, in the mid-30s on maximal medical therapy, think again. This is not a good candidate and not indicated for the procedure. If on gonioscopy you see significant synechial angle closure, especially in the nasal angle, next. If you're faced with an uncontrolled neovascular glaucoma with heavy PAS, also not a candidate. If you have severe corneal opacity and can barely see the angle structures, don't set yourself up for failure. This is not a good candidate. Also, traumatic secondary glaucoma with wide angle recession may not give the best outcomes either, and these were excluded in clinical trials. Secondary glaucomas like pigment dispersion and pseudoexfoliation may do well, but these were also excluded patients in the clinical trials, so the verdict is still out on how well they will do. Now, what about an actual case? I had a patient of mine who was in the clinical trial who I still see and did great. She was a 70-year-old female with a baseline eye pressure of 24 and 18 on Travatan Z with a target pressure of the upper teens. She had a cup-to ratio of 0.7 and a central corneal thickness of 536. She did have a visually significant cataract with a vision of 20/60, best corrected. She had the iStent Inject with cataract surgery that was uneventful. Postoperatively, she was 20/20 with an eye pressure of 16 off medications at the end of 2 years. Patients like these make great candidates and can have great outcomes. Okay, did you stick with me the whole way? Awesome. And this concludes the iStent Inject 4-part series of the MIGS University. Remember to check out the links below or the card to get access to the first, second, and third video on the what, where, why, and how of iStent Inject. Hey, if you like the video, press the like button, and if you have a friend or colleague who can benefit, be sure to share the video. Also, if you don't want to miss the next MIGS University video, subscribe and click on the bell to be notified when it comes out. We would love to hear from you. What did you think of the patient selection pearls for iStent insertion? Do you think that you can find patients in your clinic that would be good candidates? We'd love to know. So take this short quiz and let us know what you think. I didn't forget about the special gift. Look in the description box below to get access to the iStent Inject video series summary guide. In this guide, you'll find key pearls from all of the 4 iStent Inject videos that you can keep for your records or share it with a colleague, staff member, or even a patient. Thanks for watching iGlaucoma YouTube channel, a place where glaucoma innovation is made easy for eye care providers.